to you.
In this morning's Health Watch, it's some good news from the American Cancer Society as fewer people are dying from cancer with death rates below 10% in 5 years. MedStar Thoracic Surgery Chief Dr. John Lazar is here now to talk about some of the advancements in diagnosis. Really appreciate you being up early with us this morning. Good morning.
Good morning. This is right in my wheelhouse time.
All right, I figured that. The schedules are all over the place. When it comes to this latest study, what is it that you think is leading to some of these death rates that are improving?
Well, I think one of the most important things is that screening is really starting to take hold in people's minds. They're taking their personal health very seriously. And what I also think is very important is this gives us a snapshot of health data prior to COVID. So this will be a good benchmark to follow up how we're doing post-COVID.
Yeah, absolutely. And you can get, like you said, multiple ways that you can use this data. You mentioned the screenings help. So can you read into this study that it doesn't necessarily mean that there are fewer cases of cancer or fewer, less diagnosis? It's just the survival rate is better?
Yeah, so one of the things that I personally teased out of the information that I think has not been recognized as well is that what we're talking about is incidence, how often we're diagnosing it. But what we're concerned as Americans is the death rate, or are we surviving? And that number remains very, very low compared to the incidence rate. So that's saying that we're getting to these cancers at a much earlier rate. Not every cancer screening works as well, but overall, people are taking their health much more seriously.
Are there certain types of cancer that people are responding better to these days, where we've had those advancements, perhaps, that others may be lagging behind? For example, is lung cancer versus, another type of cancer doing better than others?
Yeah, so you took the words right out of my mouth. I was going to mention that lung cancer, which is the #1 killer of people in the United States from cancer. It's not breast or colon, it's really lung. And we've had a significant reduction in that over that 4-year period from 2014 to 2018. So this is really encouraging. It means that people are quitting smoking and they're staying off cigarettes, and they're also getting low-dose CT scans. It just so happens that November is lung cancer awareness month. And so I'm hoping that more and more people listening to this will go get a low-dose CT scan.
Which was the next question for you, is what can people do now to make sure that you just keep bringing these numbers down? Because it seems like it is a combination of people taking the initiative to get the screening paired with the advances in medical care.
Yeah, well, when we talk about lung cancer, it's just about today. It's about not picking up the cigarette today, not worrying about next week or anything like that. And it's about going to your loved ones and knowing that, hey, you may have smoked a cigarette for 20 years or you may have quit 15 years ago. Why don't you just get that CT scan? The insurance companies pay for it. It takes about 15 seconds. There's no needles. You just have to lie down. The only thing that we ask is that you come to your physician's office and have a conversation about, the risks of it, which are really negligible considering that the radiation that you can get from it is the same that you get walking around the earth for 30 days. So it's a great screening test.
Last thing for you real quick, doctor, it's obviously you want to try to eradicate cancer altogether, right? Which seems like a near impossibility these days. But does the medical community see results of this study as a positive thing, just that the death rate is coming down, if nothing else?
Absolutely. I mean, I think we have to take our wins where we can with cancer. And like I said, I think it's an effort by all Americans to help improve their health. And I think that's the most encouraging thing.
Well, listen, I really appreciate you joining us this morning, Dr. Lazar, and I wish you the best. I know you have a busy day ahead of you, but thanks so much for your time.
Thank you.
It's 6